this wonderful simulation center, education simulation center. Tremendous partnership between us and Murray State University. These rooms and the technology inside are unparalleled. No matter where you go, you'll not see anything like these little sim men.
Over the past 6 weeks, we have conducted several simulated learning experiences.
I feel like I could die.
Students have had the opportunity to simulate caring for a patient with a postoperative hip arthroplasty who's had a reaction to a blood transfusion. They have cared for a patient who has a suspected moderate COVID-19 infection. And they have cared for a patient with a psychiatric mental health disorder. There have been over 169 student encounters. Simulation has been shown to improve the confidence of students, their clinical judgment, knowledge, and competence. And it bridges the gap between what we teach in the classroom setting and in practice.
Take us a step further and bring our middle schools over here, our high schools over here, and they get a chance to experience this. That may be 1 or 2 or 3 more students that are going to stand in line, raise their hand, and say, yeah, I want to go enroll at Murray State University when I graduate to become an RN. So this is a wonderful opportunity, not only from the training side, but also from our school sides to help them get indoctrinated in what medicine's all about. So when you got a wonderful group of trainers, you got a wonderful group of faculty, and you can put that together with the sim center like this, it is truly a jewel in the crown of Murray State University, and also here at Murray-Calloway County Hospital as we collaborate to train top-notch medical professionals that we're going to graduate here in the next few years.